Hi, are you ready to learn more about the 2018 CPT updates? Well, stay tuned. I'll have some additional updates available for you in this video. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, we provide you with information, tips, and strategies on how to become a certified marketable medical coder. Stay tuned to the end of the video and we'll provide you with some information regarding our free email course on how to become a certified marketable medical coder. 5 codes have been added to the anesthesia section. 00731 and 00732 for anesthesia for upper gastrointestinal endoscopic procedures. 00811 and 00812 for anesthesia for lower intestinal endoscopic procedures. And 00813 for anesthesia for combined upper and lower gastrointestinal endoscopic procedures. In addition, 5 codes 00740, 00810, 01180, 01190, and 01682 have been deleted, of which 4 of them 00810, 01180, 01190, and 01682 have been deleted due to extremely low utilization. With the deletion of code 01682, code 01680 was reformatted to appear as a standalone code. Code 00731 is anesthesia for upper gastrointestinal endoscopic procedures. Endoscope introduced proximal to the duodenum, not otherwise specified. Clinical example of code 00731, you have a 63-year-old patient with abdominal pain and persistent dyspepsia, undergoes an EDG. The upper gastrointestinal tract is evaluated and multiple biopsies are taken for histology and Helicobacter pylori rapid urine test. Code 00732, anesthesia for upper gastrointestinal endoscopic procedures. Endoscope introduced proximal to the duodenum. Endoscopic retrograde cholangiopancreatography, or ERCP. Code 00732. There is a guideline in your book, CPT book, that says for combined upper and lower gastrointestinal endoscopic procedures, use 00813. Also, 00740 has been deleted. To report, see 00731 or 00732. A clinical example for code 00732, you have a 68-year-old patient presents with abdominal pain and abnormal laboratory tests. Imaging studies show an apparent retained common bile duct stone. Therapeutic endoscopic retrograde cholangiopancreatography with stone removal is performed. Code 00811, anesthesia for lower intestinal endoscopic procedures. Endoscope introduced distal to the duodenum, not otherwise specified. Clinical example for 00811, a 66-year-old patient presents with diarrhea, anemia, and intermittent rectal bleeding. Colonoscopy with biopsies of a lesion is performed. Code 00812, anesthesia for lower intestinal endoscopic procedures. Endoscope introduced distal to the duodenum, screening colonoscopy. There's another guideline. Report 00812 to describe anesthesia for any screening colonoscopy, regardless of ultimate findings. Clinical example of 00812, a 64-year-old patient is referred for colorectal cancer screening. Code 00813, anesthesia for combined upper and lower gastrointestinal endoscopic procedures. Endoscope introduced both proximal to and distal to the duodenum. A clinical example for code 00813. A 63-year-old patient with persistent abdominal pain, positive fecal blood tests, and mild anemia on laboratory exam presents for upper and lower GI endoscopic procedures to determine cause of the occult bleeding. Codes 00731, 00732, 00811, 00812, and 00813 have been established to report anesthesia management of upper and lower endoscopic procedures. Code 00740 and 00810, which were not detailed enough to capture data for reporting purposes, have been deleted. Prior to these changes, only one code existed for anesthesia for upper gastrointestinal endoscopic procedures. That was 00740, and one code existed for lower gastrointestinal endoscopic procedures, 00810. The new family of 5 codes provides sufficient granularity to describe typical patients who undergo upper endoscopic procedures and to differentiate them from patients who undergo endoscopic retrograde cholangiopancreatography. These codes also differentiate patients who undergo screening colonoscopies from those who undergo diagnostic and/or therapeutic lower gastrointestinal endoscopic procedures. The family of codes also specifically identifies patients who undergo both upper and lower gastrointestinal endoscopic procedures sequentially on the same day. Before the change, the additional anesthesia work performed during a combined procedure, such as repositioning the patient, responding to physiological changes when the scope is reinserted into a different location, and other non-duplicative work involved in the additional procedure was not being captured. You also have a note, code 00810 has been deleted, and to report, see 00811, 00812, or 00813. You also have a guideline under code 01173 that states 01180 and 01190 have been deleted. Code 01180, which was anesthesia for obturator neurectomy extrapelvic, and 01190, anesthesia for obturator neurectomy intrapelvic, have been deleted due to low utilization. This was done to ensure that the CPT code set reflects current clinical practice, as well as code 01682, anesthesia for shoulder cast application, removal or repair, shoulder spica, has also been deleted due to low utilization. And again, this was done to ensure that the CPT code set reflects current clinical practice. You also have the guideline under code 01680 that states 01682 has been deleted. Question of the day. What section of CPT do you use most, and were there lots of changes for you? Let me know in the comments section. If you found value in the information on this channel, feel free to subscribe and hit the bell for notifications of our videos. Again, I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, reminding you to be safe, be kind, and don't wish for it, work for it. Until next time, take care. Are you interested in medical coding, but not sure where to start, and scared of wasting time and resources? Let me help you with the right steps to become a certified, marketable medical coder. Learn more at bit.ly/CPT
/5 steps coder.